So this is ThermiTight that I'm going to demonstrate. And so what we're doing here for this procedure is we're trying to decrease cellulite. It works very well. I do it for cellulite on the buttocks and cellulite on the backs of the thighs. I also use ThermiTight for a pretty flat stomach to just kind of go around in there and just tighten everything up. You can do a little hand liposuction on the tummy also. I do it for the flabby part behind the arm. I do it, of course, for the chin indication, which is when it came out. That was the original indication, was for the chin. They do bruise, they swell, they're indurated, and then they love you. So their cellulite typically goes down at least 1 grade. And so she has about grade 3 cellulite, I would say. I know every woman thinks their cellulite is the worst in the world, but it's actually not. Molly's a power lifter, and so now I'll just show you kind of what we do. Sometimes you can hear the fibrous bands pop, and sometimes you cannot. Basically, I numbed her behind stage before so you could actually see the procedure. The numbing takes longer than the procedure does for this. The patient has to be comfortable. So basically, when I'm doing ThermiTight for cellulite, I keep it in the sweet spot. Right now, the actual temperature on the bottom gauge where it says ThermiTight is at 34. So I'm going to just turn it on for a second. We warm the numbing fluids before we get started so that the patient will heat up faster. And the skin temperature is the top gauge, and that can't go above 42 degrees, or it has to be cooled down with some cool gauze. Molly, can you feel anything? Okay. So that's the sound of success. They can't feel anything, and the fibrous bands are starting to pop. So you're kind of in the subdermal plane right here. We used 180 cc's of a lidocaine blended with epi with bicarb on each leg. And right now we're getting in the sweet spot. Yeah, so we want to stay around low 60s. I don't typically go above 70 for this procedure. It works well. I've been doing it for a little over a year, and my patients like it. And New Jersey patients, as I've said yesterday in my lectures, are hard to please. So please ask me questions. I just have to focus on Molly, but ask me questions. So I heard a pop there. Did you hear that pop? Yeah. So that's good. So that's the sound of success. So questions for me?
Can you do this on the anterior thigh?
You can do it on the anterior thigh, Ava. Thank you for the question. And it works very well there too, and you get a high degree of satisfaction. The fact that I can use this for the jaw and I can get rid of the jowling and I can use it for cellulite, I like things that are multi-purpose in my practice, more bang for my buck. My patients really seem to like this a lot. And the fact that I can use it on the belly, I didn't realize that. I bought it for the arms and the jaw originally, and now I'm using it more for cellulite. So I'm actually very, very happy that I purchased this device, but I like to get multi-use devices when I can. Other questions? So the time involved in this procedure is typically somewhere between 2 to 3 hours. I've been doing it for a while, so I numbed her a lot quicker this morning. But when you're doing, I typically do, I'll just stop for a second. I typically do cellulite on the thighs, and I do from the lower buttock, and I do like most of the whole lateral thigh bilaterally, and I charge about $5,000 for that. Whereas if I'm doing ThermiTight on the jaw, I charge about $4,000 for that. So it kind of depends on where I'm doing. Bellies are about $3,500 to $4,000 depending on the height of the person. I mean, I had like a 6-foot model. I'm not going to charge her the same for her belly that I'm charging somebody who's 5'2", that was my original patient, that type of thing. Other questions?
Is there anybody who's not a candidate for this, Dr. Downie? Any contraindications?
You okay? Somebody who's not a candidate is somebody that's morbidly obese, overweight, obese, with really saggy, droopy, kind of like 5+ cellulite. Somebody that exercises and power lifts like she does, but has some cellulite that she kind of wants to do something with, is a better candidate for this, quite frankly.
If they have a pacemaker or any implantable device?
If you have a metal hip, I will not do you. You know, I know there's another person in my town that actually will, but I won't. But, you know, basically most people are candidates for this procedure that have grades 1, 2, 3, or even up to 4 cellulite. Depends on the sagging and the turgor of their skin. Those that are tight, like Molly is, tend to do better. So she's an excellent candidate for this procedure.
With Cellfina, it typically, I would say 75% of the treatment time is the tumescent anesthetic delivery, and the other 25% of the time is the actual releasing of the bands. And again, it depends on how many there are.
Molly, you are doing so good.
Yes.
How long will it take you to go start to finish?
For our patients,
Yeah.
the photography probably also takes a while, but I have people in the office that do that. So I will say, I tell patients when they come to the office to plan on being there for 2 hours, because they're going to come in, sign consents, the photography, then
Molly,
the
I'm
numbing
sorry, I
part,
love the pops.
and afterwards, but that's about what it takes, I would say, on average.
How are you doing?
Yes, question. One of the important aspects of this, I think, is bringing awareness to market that there really is something that can be done. So I think the fact that we can have something that can be done reproducibly and consistently, and then bring a new patient demographic in, that's what I see the value in it.
Liposuction, if you do body work,
Yeah.
if you have a large Celtique population, the Cellfina is a great
It is.
sort of adjunctive.
And again, I've had the treatment. I know exactly what it feels like. I'm 55 years old. I don't exercise like I should, but I'm not completely sedentary either. And so I can tell you, and I know what my next thing is going to be. It's going to be cool sculpting for banana roll, and then I'll probably get some Exilus, maybe a little Cellutone, and and keep going. I think it helps to have experience with our, as patients as well, in being able to talk to something. So I know exactly what UltraShape feels like. I know what Cellfina feels like. I know what Ultherapy feels like. I know what Fraxel feels like. Yes.
Okay, just make sure that doesn't.
So banana roll is, well, I didn't have those pictures up there, but it's that little thing that it's almost like that little stripe, like 2 striations, and it looks almost like a little roll right there. But those are some anatomic landmarks there that you don't want to release, or you're going to create like a pouch and some laxity.
And Vivian, can I interrupt you for a second?
Yes.
With this device also, when you're
treat the
doing
banana.
closer to the lower buttock area, you can actually decrease that little butt roll that people call a banana roll with this procedure. That's not what it's indicated for at all. I just found this out while I was doing cellulite. My patients are commenting that their banana rolls look better. So now I'm actually focusing on that more.